Following segment is sponsored by Synexus. When it comes to things your body is telling you, there are some health symptoms you should never ignore. Research has shown that during the pandemic, up to 40% of women reported that they skipped preventive health services and routine checkups. Joining us to discuss and update us on the many health ailments women may want to ignore but shouldn't are Dr. Azieh, VP of Clinical Development for Synexus, and Nurse Barbara. Great to see you both.
Hi, Carrie. It's so great to be here with Dr. Nkechi Azieh on behalf of Synexus to talk about women's health.
Yes. Okay, let's start with Barbara. How big of an issue was women skipping preventive health services during the pandemic?
Carrie, I don't have to tell you or your viewers that about 40% of women understandably avoided going to see their providers for their annual checkups, their pap smears, their mammograms, but they were also avoiding seeing us because if they had a vaginal infection that they felt like was never going away. But let's change that because it's May. Mother's Day is around the corner. It's Women's Health Awareness Month. Now is the time to refocus on women's health care.
Yes, absolutely. And Barbara, what are some of the health conditions that women might want to ignore but absolutely shouldn't?
Well, we're so busy taking care of everybody else in our life, so oftentimes we ignore our symptoms, and sometimes it's from fear or embarrassment because these are very, very private and personal issues, especially when it comes to vaginal yeast infections that may never be going away. But if you're dealing with this, you're not alone. 70%, that's 7 out of 10 women have a vaginal yeast infection at some point during their life, and half of us have recurrent or multiple episodes during our lifetime. But don't despair because there are new treatments that may be appropriate.
Yes, definitely something to pay attention to. And why is it so important to see a doctor about infections and other health concerns instead of suffering in silence?
Well, we're used to suffering in silence, right? But when we do that, when we ignore symptoms, they just get worse. And it's like having a paper cut and a mosquito bite in a very tender area. And Dr. Azieh, I know you have devoted your entire life to curing infectious diseases, and yet we both know that some of the medications and the treatments don't work for everyone, do they?
No, they don't, Barb. And that is why it's very important that the women know that there is something new that has become available in the last year or so. Listen, ladies, I know that there has been only one type of medicine available to treat yeast infections in the last 20 years, not much of an advancement. And you go to your doctor, you get the same medicine, whether it's over the counter or prescription, it's the same type of medicine. And sometimes these just don't work for some patients. And you get tired of receiving the same thing over and over when you go. But I can assure you now it's a new day. There's hope in the horizon. And you can go back because there has been some alternatives that's become available to treat the yeast infection.
Yes. Thank you so much for joining us today. These are great reminders. Where can we go for more information?
So for more information, you can go to www.yourvhealth.com. Now, the V stands for vagina, so yourvhealth.com.
Perfect. Perfect. Thank you both for joining us. Have a wonderful day.
Thank you, Carrie.